In today's society, light does more than just illuminate our homes. It also saves lives. Optical fiber is essential for everything from high-speed internet to cutting-edge operation. But did you realize it's also transforming the medical field? In this video, we look at how a little strand of glass is driving huge discoveries in healthcare. What is optical fiber? An optical fiber is made up of thousands of tiny strands of glass or plastic that transmits light. Unlike ordinary cables, which carry electrical impulse, optical fibers utilize light to transfer data. This makes them perfect for quick, precise, and interference-free transmission even within our body. Let's look at the structure of optical fiber. Optical fiber made out of 3 layers, which are core, cladding, and jacket. Core is a thin glass at the center of the fiber through which light travels, while cladding is the outer optical material surrounding the core that reflects the light back into the core. Lastly, jacket is the cable outer covers that protect the bundle of optical fiber. There are 2 main types of optical fibers, which are single mode and multi-mode. They both transmit light, but they do it in a very different ways. Let's start with single mode fiber. In this type, the light wave travels in a straight line or the same pattern like single ray of light. Because the core of the fiber is very small, it allows only one path for the light to travel. This makes it ideal for long-distance communication, like sending data across cities or even countries. However, the small diameter also means it can slightly reduce the strength of the signal, so it needs special equipment to boost it. On the other hand, we have multi-mode fiber. Here, the core is larger, so the light spreads out and travels in multiple paths as it reflects inside the fiber. This design makes it better suited for shorter distance, like within a hospital or a building. Because of the wider core, the light bounces more, which can cause light signal loss or delay over long distances. But for local use, it's fast, efficient, and easier to install. How do optical fiber work? Through a process known as total internal reflection, light signals are bounced along the interior within the fiber. Light is adequately contained by a layer known as the cladding. This technology facilitates precision, speed, and miniaturizations, which are essential components of medical practice.
Today, I would like to talk about the concept of optical fibers in physics. In physics, the total concept of optical fiber is based on the principle of optics, particularly the phenomenon of total internal reflection. Total internal reflection occurs when a light wave traveling from a denser medium encompasses a boundary with a less medium at an angle greater than the critical angle. Instead of being refracted, the light will reflect into the denser medium. Optical fiber utilize total internal reflection to transmit light signals over long distance with minimum loss of thickness range. Here's the breakdown of key concepts involved. First, refraction. When light travels from one medium to another, such as from air to glass or plastics, it changes direction due to a change in the speed of light. This change in direction is known as refraction. The amount of bending depends on the difference in refractive indices between 2 mediums. Secondly, critical angle. The critical angle is the angle of incidence at which the light ray traveling in a denser medium is refracted, angle of 90 degrees to the boundary. Beyond the critical angle, the light ray undergoes total internal reflection rather than being refracted into the less medium. Thirdly, core and cladding. Optical fibers consist of a core and a cladding. The core is the inner part of the fiber made of a material with a higher refractive index than cladding. The cladding surrounds the core and has lower refractive index. This refractive index difference ensures that entering the core is reflected internally. Next, the total internal reflection. When light enters the core of an optical fiber at an angle greater than critical angle, it undergoes total internal reflection. The light rays bounce off the core cladding boundary and continue propagate down the fiber. 10. Light propagation. By repeatedly reflecting off the core cladding boundary, the light rays are guided along the length of the fiber with minimal loss. This enables the efficient transmission of light signals over long distance without significant degradation. Lastly, dispersion. Optical fibers can experience dispersion, which is the spreading out of different wavelengths of light due to difference in their velocities. Dispersion can be minimized through the use of specialized fiber designs and materials.
Now that we understand what optical fiber is and how it works, let's explore how it's being used in the medical world. Let's start with endoscopy. In this procedure, doctors use a thin, flexible tube called an endoscope to look inside our body, like the stomach, intestines, or throat. This is possible thanks to optical fibers inside the endoscope. Light is sent into the body through one fiber, and the reflected image comes back through another fiber. Using the principle of total internal reflection, the light keeps bouncing along the fiber without escaping until it reaches the internal organ. This allows doctors to get a clear, live image from inside the body without needing the surgery. Next is laser surgery. Here, optical fibers are like a light delivery system. They carry powerful laser beams to very specific areas of the body, such as the eye, kidneys, or even tumors. Since the light travels through the fiber using total internal reflection, it stays focused and doesn't spread. This allows surgeons to perform highly accurate procedures that are less painful, faster, and cause less damage to the surrounding tissue. Lastly, let's talk about imaging and diagnostic. A great example is optical coherent tomography, or OCT. It uses optical fiber to send light into tissues, especially in the eye. The reflected light is then used to build a 3D image of the internal structure, like the layers of the retina. This helps eye doctors detect problems like glaucoma or macular degeneration very early, sometimes before symptoms even appear. Optical fiber brings several key advantages to medical technology. First, it allows for minimally invasive procedures like endoscopy or laser surgery, which means smaller cuts, less pain, and faster recovery for patients. It also provides high-quality, real-time imaging, which helps doctors make quick and accurate diagnoses. Another advantage is that optical fibers are not affected by electromagnetic interference, so they can be safely used near machines like MRI scanners. Plus, they are lightweight, flexible, and can reach deep or narrow parts of the body that regular tools can't access. However, there are also a few limitations. Optical fibers, especially the glass ones, can be fragile and need careful handling. The equipment can be expensive to make and maintain. Also, using them often requires specialized training since the tools are delicate and precise. So, while optical fiber is extremely useful, it's not always suitable for every medical situation.
Optical fiber is a thin, flexible strand made of glass or plastic. It might seem simple, but it's one of the most powerful tools in modern technology. At its core, optical fiber works using a fascinating principle in physics called total internal reflection. This allows light to bounce and travel through the fiber even when it's bent or twisted. Because of this, optical fiber can carry light and information through long distance with very little loss. But beyond communication and internet cables, optical fiber plays a huge role in medicine, a role that has changed life around the world. In the medical field, optical fiber enables a range of non-invasive and minimally invasive procedures. For example, in endoscopy, a thin tube fitted with optical fiber is used to view inside the human body without making large incisions. This allows doctors to diagnose problems quickly, safely, and without major surgery. In laser surgeries, optical fibers deliver laser beam with extreme precision. Surgeons can remove tumors, repair damaged tissues, or treat delicate areas, all while minimizing harm to surrounding healthy parts. It also used in cancer therapy, helping doctors target and destroy cancer cells with great accuracy. What makes optical fiber so important is what it offers to both doctors and patients: precision, safety, and faster recovery times. Patients experience less pain, smaller scars, shorter hospital stays, and a quicker return to normal life. Today, optical fiber stands as one of the most vital innovations in medical technology, which is improving the quality of care, saving lives, and shaping the future healthcare.